Welcome to the Inspiring Good podcast. This podcast is brought to you by the Community Foundation of Elkhart County, which serves a vibrant community in northern Indiana known for its generosity and strong network of nonprofit organizations. I'm Marshall King, your co-host with Kevin Deary, a veteran nonprofit CEO who now coaches others. Our guest this morning is Paul Shetler Fast, the Executive Director of Maple City Healthcare Center. He was born in Africa and found his way to Goshen before going on to work nationally and internationally. He returned to Goshen with his wife, Rebecca Shetler Fast, and their children, and is contributing to our community in rich ways. Paul, good to have you here. Welcome.
Thank you, Marshall. It's great to be here.
Paul, we are excited to have you here. Tell us a little bit about Maple City Health and exactly what the mission is.
Yeah, so Maple City Healthcare Center is one of our region's best kept secrets. We've been around for 35 years, but many in our community haven't heard of it or haven't experienced it directly. Maple City Healthcare Center, our vision is working for a healthy community where everyone is cared for, because unfortunately, we know that that's often not the case, that we all face health challenges in our life, all different kinds, and many in our community don't have places where they do feel cared for or are able to get the health care they need. So we try to provide a really quality, comprehensive health care that's actually accessible. It's affordable. People can get what they need. And so that starts with primary care, but it includes pediatrics. We do autism evaluations. We have mental health and addictions. We do pregnancy care. We do our own deliveries in partnership with Goshen Health. We have nutrition. We have medications. We do in-house labs. We have dental programs. So it's a pretty comprehensive set of resources that we try to provide at costs that are affordable to folks, meet them where they're at, take any insurance, and then do this in a way that meets the highest quality standards. So we're consistently ranked as one of the top quality health centers in the country. We again have the highest ranking from the federal government's program for health centers, which puts us in the top 3 clinics in Indiana. So it's extraordinarily high quality care. It's where my family goes for care, my kids get care, and then trying to make that also affordable, accessible to everyone.
I love the fact that's where you and your family get care as well. Because this provides a real service in our community by relieving the emergency room as the primary care provider, which that should not be the case.
Absolutely. So we serve about 10,000 patients a year. And what we know is that the research shows that when you provide quality, comprehensive care like we're doing, every patient that comes to us on average and stays with us, that's going to save the healthcare system, generally our community, around $1,700 per year per patient. And that's really concentrated in avoiding those emergency room visits, urgent care, unnecessary specialty appointments, keeping things from like diabetes, hypertension, keeping those under control so they're not escalating, because an hour in the emergency room is going to cost more than 2 years of primary care. And so getting that preventive care to folks and managing their conditions early, it's better for the person, it's better for that individual, it's better for our hospitals, it's better for our community.
Got me thinking about, you said diabetes and high blood pressure and the cost of drugs. If you can't find, or how do they afford, do you have any connection through pharmaceutical to make it easier for people to handle their diabetes and blood pressure and heart conditions?
So this is one of the amazing programs that we have access to at Maple City Healthcare Center. We're part of a program called 340B, which allows us to essentially buy medications at cost from the pharmaceutical companies, and we pass that along at cost. We don't make $1 on our medications program. We pass that along at cost to our patients. So if you're our patient, and this can be everything from insulin to if you've got a kid who has an allergic reaction, you need an EpiPen. If you go to the pharmacy and you need that med, that can cost hundreds of dollars. And yet the actual cost of producing it is maybe $5 or $10 for the pharmaceutical companies. And so because we're able to buy it at cost, almost all generic meds, normal meds, insulin, hypertension meds, et cetera, those we can pass along at generally $5 or $10 to the patient, that often makes the difference between someone being able to keep their diabetes under control, keep their hypertension under control, even take if they need meds for depression or anxiety or whatever their condition is. That is a key part of accessibility that is often missing in our healthcare system.
Now, as a CEO at the Boys and Girls Clubs, and Goshen was our kind of epicenter. I know that I worked very closely with Dr. Gingrich in the early days on the north side, and that Maple City Health was no secret to all of us. we knew that it provided a very part of healthy families and healthy communities and healthy neighborhoods. Always very grateful for being our children and our families were often shared, and we knew that we could take good care of the families, particularly the children and the elderly in those families. So to me, I've always had a big heart for Maple City Health, but you still have just the one location. Have you grown?
So that first location, which opened in 1989 across from Chamberlain School there on the north side of Goshen, that's where we started. And it was an old fire station, and it grew really slowly. And then in 2015, 2016, we added our Vista Clinic. So that's just up the road. It's the old mansion on the hill as you're headed up toward Bristol. And that became our second clinic. And during COVID, we added a dental clinic at that same Vista site. And then last year, we added Peddler's site out at Peddler's Village, which we call West End. So we now have 3 integrated primary care clinics. All of those have that full range of services from OB to pediatrics, primary care, mental health, et cetera, and then the dental clinic. So that's how we've been able to add so many more patients. We had been stuck even with the 2 clinics only being able to have 5,000 or 6,000 patients a year, and then now last year we took care of almost 10,000. This year we're on track. We're going to be more like 12,000 by the end of this year.
And I remember when 3,000 was the absolute limit.
Yep.
And then it suddenly grew, and obviously the arrival of you back to Goshen, because originally you'd gone to Goshen College, I believe, or a Goshen resident, but you were born in Tanzania.
Yeah.
So tell me about that.
So my parents were working for Mennonite Central Committee, which some folks around here might know from the relief sale that happened and the great food there that raises money for their mission. So they were working in East Africa. My brother was actually born in Ethiopia, and then I was born in Tanzania while they were working there, doing community development work, humanitarian work. And so that gave me a really unique perspective growing up in another culture where the folks around me were not like me in many ways. And so how do you connect across cultures and languages and understand the just vast differences that we experience in how we grow up, in the cultures we're raised in, our economic situation, and yet fundamentally how similar as humans we all are, and struggle with issues of health and how are we going to take care of our family and what are our dreams for our kids. And there's this shared humanity even while there is a lot of difference.
I love the shared humanity comment. I've probably been in 22 different countries, Africa, Middle East, Europe, Mexico, Caribbean. And until you travel some of these second and third world nations and see the things that we take for granted, particularly in healthcare. So what was the tipping point for you, Paul, when you said health is what I'm going to do, and not just health, but health for those that need it the most?
Yeah. So some of my earliest memories, we were growing up in Tanzania, and this was at a time when the HIV epidemic was spreading completely unchecked across Africa. And it wasn't something people talked about. The disease wasn't well understood, and there was no treatment that was effective. And so people were dying. Lots of people were dying. I went to way too many funerals of family friends, of parents of my friends. And you saw just this devastation in the community. You saw issues of stigma and blame. You saw problems of people not even being able to access sort of basic dignity when they're going through something like that. And so this sort of conviction that health is really important and it can be taken away from us quicker than we can imagine, and that we need the community to come together to care about that. Some of my other memories from that time are riding on the back of a motorcycle that was doing these vaccine clinics in places that otherwise didn't have access. So I got to tag along with the community health worker and, basic vaccines there. So that was another experience of getting into the communities that need it most. And then what is our role in helping people access care that they need, that they feel comfortable with, and that helps them avoid problems down the road.
Paul, you went to Goshen College, and then you, I believe, moved to Pittsburgh, right?
Yep.
And then got a graduate degree and took a job with the Veterans Administration?
That is correct.
So walk us through this path of how you ended up in this seat at Maple City Healthcare Center. And are you still on the county health board as well?
Yes, I'm the chair of the County Board of Health. Yep. I don't think you would give my life story as like a roadmap for someone trying to end up in this role. There's a lot of twists and turns, a lot of saying yes to needs that were put in front of me, opportunities that were put in front of me. I had an early mentor who advised me not to think I was so smart as to be able to plan the future and instead do well at the task in front of you and be open to what doors God opens for you. So yeah, when my wife and I were married just out of Goshen College, we moved to Pittsburgh so that I could go to graduate school. And that was to study international development and nonprofit management. My wife and I, we were newlyweds. So we were playing tag team. She worked as a social worker while I went to school, and then got a job while she went to school for her master's of social work. And so we needed to be in Pittsburgh, and there was a fabulous opportunity to jump into the Department of Veterans Affairs in their healthcare side. So it was a program where you could be fast-tracked into mid-management. So straight out of school, I was brought into really interesting regional programs with the Department of Veterans Affairs, and then got my first supervisory job at the Butler VA, and that was just transformational for me. Seeing healthcare from the front lines, getting to understand that kind of a system. Also, as a new supervisor, I was supervising physicians and other specialists who had been doing this work for longer than I'd been alive. And so what's my role in understanding how do you supervise with humility and yet add value to the mission there? From Pittsburgh, my wife and I were both, successful in our careers, things were moving, and yet we found ourselves called to do more. And we were asked to consider a position in Haiti. And so we were reflecting on that, praying on that. And during that time, I decided to go back for a master's of public health. I knew that I loved healthcare. I loved community health, working to help the whole community, not just deliver healthcare services. So not just focused on how to see more patients or how to improve this outcome, but really to help the health of the community. And I went back to that, got my master's of public health before going on to Haiti.
So funny how things come full circle. The Peddler's Village site is a former VA medical office that there's a beautiful story about how it became your third site. And this site serves a number of Haitian immigrants in this community. Your clinics serve a wide range of nationalities. The languages spoken in your offices, the number is remarkable. How do you serve the entire community and probably see the entire community in some ways that most people don't? Tell us what.
Yeah, we live in an incredible community and also a really diverse community. People coming from all kinds of backgrounds, all different economic levels, languages. So in Indiana, our clinic serves more people who receive care in a language other than English than any other. Spanish is clearly a big part of that, knowing our community. Haitian Creole is now number 2 after Spanish. And when I went to Goshen College here and when we moved back from Haiti, we moved here to be closer to family, I thought I was never going to use Haitian Creole again. There hadn't been a community here, but that's grown rapidly in the last several years. And so being able to use that, being able to interpret for patients who need that care, that's been wonderful. We have tons of Ukrainian and Russian speakers, many who have fled that conflict, and then all kinds of others, Arabic and Cambodian and Vietnamese. And it's a really rich community we live in. And then we have folks who have come from all over the U.S., some who have grown up in Elkhart. We have patients who drive. We just pulled a map the other week of where our patients coming from. We have patients who are driving from Terre Haute. We have patients who are driving from near Chicago, from southern Michigan. They are passing a lot of clinics on the way to come to Maple City. So what is it about us that we try to be that place where they can feel welcome, they can feel comfortable? Healthcare needs trust. We lost a lot of trust in healthcare in our community over the last several years during the COVID pandemic. People want to have a place where they feel understood, they feel respected, they feel cared for, and people will go a long way to find that. And so we see that at Maple City.
There are a lot of conversations right now at the national level with who's going to step in. I think Senator Kennedy is online to become the czar of the health world. What's the correlation to that as far as the federal government, what the direction they can, and the impact on local health communities? And I'm not specifically targeting Mr. Kennedy. I was talking about just anybody in that position.
Yeah. So our health systems in the United States are really complicated, and they're very intertwined. And so what happens at the federal level with programs like Medicaid, which provides health insurance to about 1 in 5 Americans, lots of kids, folks with disabilities, and folks on lower incomes. Of course, we've got Medicare, which provides coverage to a lot of people. federal grants that allow us to try new things. And part of our ability to, for example, add developmental screenings, we were finding that a lot of our kids who would get screened for a developmental problem, we had nowhere to send them for evaluation. And so they weren't able to get treatment. So even though we have great partners like Logan Center, for example, in the area, they weren't able to access those services because they didn't have a diagnosis. And so we were able to bring that in-house. Part of that was supported by a federal grant. So there's a lot of interconnections there. The bigger issue we have in our country right now is this: which direction is healthcare going to go? Healthcare is broken in the United States. It's expensive. We spend more than any other country in the world. And we're not always getting the best outcomes. We have a lot of health problems in our country. People are suffering. And how are we going to find solutions that are affordable, that are accessible, where people feel comfortable to get preventive care? If your leg is broken, you're going to go to the emergency room. But are you going to go in before you're sick, before it's a crisis, to make sure that diabetes is managed well, that hypertension is managed well, that you're getting treatment for that depression before your life is in crisis, that you're getting your kids screened for issues before they need that specialist care so we can address it early? Those kind of solutions, they're better for the individuals, they're better for our community, they're better for our country, but they require a different direction in healthcare, that of the inertia of more specialists, more expensive treatments. This healthcare industry is really driven towards those kind of expenses, and primary care, the kind of work we do at Maple City, that tends to be underfunded. We operate on a shoestring budget. Everyone shares offices. We pay less than our competitor, for particularly like our physicians, for example, our leadership positions. People do it for mission. But the reason that has to exist is because there's not the same sort of money in primary care and preventive care as there is in specialty care in the United States.
You mentioned your staff. How many staff do you have? What's the breakout of doctors, nurses, physician's assistants, nurse practitioners, paraprofessionals, social workers, mental health? You are really across the board.
We have a phenomenal staff, and just from diverse in all kinds of different ways, including professionally. So we have 155 staff. We have 4 physicians at the moment. We have 22 advanced practice providers. That'd be nurse practitioners and physician assistants. We have 13 social workers. We have 2 nutritionists. We have a dentist. We have 3 hygienists. We have nurses and medical assistants. We have a team that's really there to wrap around the patient. And these are people, again, they're top of their game. They're also, in general, they're taking a cut to come to us. We just had another physician just yesterday who agreed to join our team later this year. She's taking a significant cut from where she has been working in the community, but she wants to be there because it's a place where she can live out her why. She can be there for the patient in the way that the patient needs without having to deal with all the other issues in healthcare, and to be able to really focus on the patient with this kind of a supportive team around her.
So this is your first chance to be an executive director?
It is.
When you become an executive director, CEO, it also comes with a board of directors.
Uh-huh.
So what lessons have you learned working with and for a board?
Yeah, we have a great board at Maple City. We have a unique board because we really want to represent on the board the community we serve, and so that those voices of the patient, we never want to go far from what does this feel like from the patient's perspective? What does our community need? Where are those gaps in what we're providing the community? Most of our board members are patients themselves, and they represent a wide variety of educational backgrounds, of different income levels. They've experienced individually, like, what is it like to be uninsured and trying to access healthcare? What's it like to be on Medicaid? So some of these difficulties that our patients face, we like to be able to have that on our board. And that's been really rewarding. They're a great board to work with. You have a lot more bosses as an executive director, because that whole board you're responsible to. And they each bring their own perspective, their passion, what they're interested in. So it's been a learning.
So, Paul, we referenced that you're the head of the county health board. Leading that group is very different than dealing with the board of your organization and as its executive director. The county health board is looking at the bigger picture and political. So how do you navigate that? What's your goal there, the tasks of that board, and how do you try to help improve the health in our community?
Yeah, so it's interesting because both organizations, in some ways, we share a lot of the same mission and vision. We want a healthy community. Maple City, we've got our way of addressing that with the kinds of services we offer to those patients and their families. The health department, and in Indiana in particular, public health is local. Yes, there's a state board of health, but all the action, really the responsibility for public health is at the local level. And so I was asked to come in as we were coming out of COVID, and it had been really rough in our community, and a lot of people had lost trust. There was, what you need in public health is a shared commitment to a vision of a healthy community. And theoretically, scientifically, there's a lot of stuff we could do to improve the health of our community. But what the public health department should be working on are those things that, yes, can advance the health of the community, but they're the things we as a community are agreeing to do together. We are responsible to the elected officials. They're the ones who appropriate the budgets. They're the ones who are in touch with the voters directly. And we need to be respectful and responsive to them, and really together try to figure out what are the things we should be working on. And so helping guide them, work with with the team at the health department, the board of health, and then our elected officials to come up with what are those priorities that we as a community agree on. And those are great things. We're trying to reduce maternal and infant mortality. We have, frankly, terrible rates in our county that no one's satisfied with. We should not be satisfied that more moms and babies are dying in Elkhart County than in many of our neighboring counties. We're working on things like sexually transmitted infections, which no one wants to talk about, and no one wants to do that work. No one wants to think about tuberculosis infections, but they're important. We need to preserve our community's health. We need to keep these kind of issues in check by making sure people get tested and treated effectively. And so the health department really fills this gap. They make sure that we're watching all the issues. If there's things Oaklawn is the right organization to take care of, more power to them. Let's support Oaklawn in doing that. If the hospitals are willing to take on certain parts, excellent. Let them do it. Maple City, Hart City. We've got a lot of great community partners, and the health department is doing more and more granting to community partners rather than trying to do all the work themselves, and that's been really productive. But what are the gaps that are missing? So as we're looking at these priorities, maternal and child health, chronic care, mental health and addiction, suicide prevention, sexually transmitted infections, these are some of the things that the health department, along with our elected officials, the Board of Health, have all agreed together. These are things we can do, and these are things that the community agrees are priorities, and we want to see a healthier community.
I just want to draw the correlation as I was listening to you talk about the challenges and opportunities that are out there. I'm sure you've heard of the organization CAPS, because
Indeed.
you guys are so aligned in your vision. Of course, your wife being Rebecca Shetler Fast, in charge of CAPS,
Yeah.
the executive CEO there. But it's amazing how you are all linked together. And it's a lot of social service agencies
Absolutely.
should be linked together. And sharing resources, sharing information, I think that's because that is integrated health right there.
And that's been one of my biggest priorities when I came. We are not a little clinic on the hill separate from the rest of the community. We are part of the community. So the moment we had spaces opened up for patients, the first places we reached out to were those community partners that serve some of those vulnerable people in the community. Boys and Girls Club is on that list. Basher, CAPS, Oaklawn, the clubhouses, jail ministries, RETA, all these organizations that serve vulnerable folks in our community, to make sure that we're interconnected, that we can get the individual, the family, the care they need and when they need it, and being open to what do they need. So one of the things CAPS came to us with in the last year was saying, hey, these sexual assault nurse exams. So when a child, for example, in our county has experienced this awful thing, they have experienced a sexual assault, there's a lot of things we need to do for that kid, a lot of things we need to do for that family. And one of them is this exam, a medical exam. And right now in Elkhart County, we don't have that available for kids. We have to send them to St. Joe or to Fort Wayne. And is this something you could do? Absolutely, it's something we can do. So it's going to take some work. We're working on getting people trained with community foundation's help. We're working to get folks trained so that this year we can add sexual assault nurse examiner services here in Elkhart County for kids, so that we don't have to be asking families on what's already the worst week of their lives that they need to go across county lines to do this. And we can do it in a way where we're doing it as integrated care. We can provide the mental health supports, not only for that kid, but for their whole family? Is there other medical needs that have come out of this? How can we help this family by just wrapping our arms around them instead of having this fragmented service system?
Since we're both Goshen College alum, we've had conversations about providing services for all the students, particularly international students who may not have, obviously, access to a doctor, and being able to find health care, mental health care, even prescriptions for sore throats, things that may hit our students. Is there continued conversation around that?
Absolutely. Goshen College is one of our other key partners. We get a lot of students from them in our nursing program, our social work program. Some of our physicians eventually are Goshen College grads that come back around, our nurse practitioners. And how do we serve that community as well? They're a part of our community. So we have a referral pathway opened up where they can send students and their families to us. That would be those kind of relationships are really important because sometimes we forget all the people who struggle to access care in our community. Another demographic that people often forget is pastors of small churches. They're often too small to be able to afford health insurance plans. So those folks are often on Medicaid or maybe trying to struggle with marketplace plans, which can really leave you out in the cold. And that's a demographic we serve that people wouldn't think about. There are just so many people in our community who face these barriers to healthcare, whether it's mental health or addictions. It's finding a place where you can deliver your baby and feel comfortable and get all your care for your family in one place. That Maple City really does serve the whole community.
Well, we hope you don't get called away somewhere else because we highly value what you bring, your leadership skills, all with humility and with great respect. So we hope that you're never called away. We hope you stay here and retire. But if you do retire here, help me understand, what would your vision be for the next 10 years?
For Maple City?
Maple City.
So Maple City's next 10 years are going to be one of growth and partnership. The needs in our community, every time we add a service, every time we open up new capacity to the community, it only opens up, it reveals more need in the community. I mentioned that we added these autism evaluations, being able to do that in-house. When we started, we knew that our kids were waiting about 2 years between screening positive on a developmental screening and actually getting services, which completely it undermines the value in early intervention if you're waiting 2 years in a small kid's life. We thought, if we get a part-time person who does this a couple hours a month, it's going to meet the need for our patients. She's now doing about a day a week. We added another provider who's doing it. They filled up, and now we just sent one through a program through Riley's Children's Hospital to get trained so we can add a third provider doing these. When you add the services, it's amazing to see what is needed in our community. And the same is true on partnership. We're working really closely with Oaklawn, with many of these other partners, with Beacon, with Goshen Hospital, so that we can see how together we can do better. Because it's really hard to access healthcare in this country, and it's really hard to navigate all these fragmented systems. So what can we do to make our health records talk to each other? What can we do to make it seamless for the patient to when we can take care of them, and then when do they need to go to Oaklawn, and then how can we bring them back in ways that are just smooth for that patient? So it's going to be one of trying to do more and trying to do more together with these community partners.
So I'm a little bit older. I was born in Boston, never had health insurance. I had two things that stick in my mind that shaped my future and why I eventually served on a local hospital board of directors and eventually as president, were two things that shaped my life at very young, not having health care. The first one was when I was 6 years old and living in Boston, and I remember I was punched by an adult and I ended up with a fractured jaw. And I remember being sent to Mass General Hospital, and at that time in the 60s, African American and Irish they were serviced at Boston City Hospital. It was a different day. And I remember they put us, because we didn't have a vehicle, we got there by cab, but I remember being sent by cab to Boston City Hospital, where I sat holding a towel to my mouth. I couldn't close my mouth. I was in a lot of pain, and eventually got good care and moved on. Second one was when I fractured my ankle at 10, playing, jumping off curbs or whatever I was doing. And I remember going to a street clinic, what we called street clinic back in the 60s. And I remember I'm not sure he was a doctor. I think, if you ever wonder where third and fourth year medical seniors who fail, where do they go? They used to go to street clinics because it was good enough. And we've come so far from that. I just remember having this gentleman put a cast on me that wasn't straight, and with a cigarette in his mouth, and I assumed he was a doctor. And I remember that because it was a long time ago, but our country has come so far, and the people like you who have a vision to create real health advantages for people who don't have insurance and don't have anybody to provide that. And I'm just so grateful from that standpoint for what you bring at Maple City Health. From that, I wanted to add those stories because you never know what people's paths have been or what their potential could be. And so I just wanted to personally thank you for the great work at Maple City Health.
Thank you, Kevin. And when you've experienced it, when you've experienced what it's like to be on the other side of these health divides, you never forget it. My wife and I delivered our first baby in Haiti. The person who was supposed to help deliver, who spoke English, was not available, so we did it in another language. Once you've been on the other side of that, you'll never look at it the same. And unfortunately, way too often, we're satisfied with these two tiers of healthcare. And we at Maple City, part of our vision is this is healthcare. This is of a quality that if you have all the options in the world, you'd still come and get care with us. Some of our biggest donors are patients of ours. Our staff who have health insurance, they could go anywhere. Over 90% of them choose to come with their families to our clinics, just like I do with my family, because that's the level of quality we should be shooting for. Not that it's good enough and everyone should be grateful. No, these are human beings who deserve care, who deserve dignity, who deserve healing. And so the only way we can do that is if we're doing it in a way that's at that highest level.
Paul, our community is a better place because you and your wife and your family are here. So thank you for the work you do. We always close the podcast with a simple question. What gives you hope?
So what's giving me hope, what often gives me hope, and maybe Kevin can relate to this as a former Boys and Girls Club, when you hang out with children, when you see the spark they have for life, when you see the joy they can get and the difference you can make in their lives. So we have 2 young kids, and they keep me humble. They keep me waking up at 4 or 5 in the morning with their excitement for whatever we're going to do that day. And being able to see the change we can make in the lives of the children we serve, the children personally, in our family, my kids, that hope, that spark, the life. My kids are really into Lord of the Rings, and one of the quotes from there is, "Where there's life, there's hope." And I would say that's part of what drives me to healthcare. When we can serve life, when we can help people live and thrive, there's always hope, and we can be there for folks when they need it most.
This show is a production of the Community Foundation of Elkhart County. It is powered by equipment from Sweetwater and recorded at the Community Foundation's offices in Elkhart's River District. Editing is done by the award-winning communication students at Goshen College, home of one of the best college radio stations in the nation. Listen to Globe Radio at 91.1 FM. Music is provided by Sensational Sounds. Learn more about the Community Foundation of Elkhart County at inspiringgood.org. You can follow us on Facebook, Instagram, and LinkedIn. Thanks for listening. We hope you're inspired and inspire good in your community.